Hello, ladies and gentlemen, brothers and sisters. Welcome and welcome back to our channel. This is the Word-Based Life, and it's a platform where we share godly content as well as information pertaining different aspects of our lives. The aim is to publicize Christ and to edify you spiritually, to encourage you in the Lord, as well as just to help you or help us live a worthwhile, abundant life that Christ has promised us. I'm your host, Rusa Hambelela, and I'm so excited to have you here. So if this is the kind of content that you're interested in, I urge you to please hit that subscription button if you haven't, like, share, and just to help promote the work that we do here. So you would agree with me that in order for you to live a fulfilled life, it's very important that you are healthy. Somebody rightly put it that your health is your wealth. So for you to live an abundant life, you need to be healthy. And you can amass all the beautiful things that life has to offer. But if you're not healthy, you know that you won't be able to enjoy your life. So today, I am joined by my beautiful sister here. She is a nurse by profession with several years of experience in the health sector, and she's going to educate us on how to take care of our lives to remain healthy and sound. So sister, you're welcome to the channel. Thank you so much for honoring the invitation.
For having me.
Okay, so before we start, I've already publicized to everybody, or I've already told our audience that you are a nurse, but we want to know a bit more about you. Can you just introduce yourself?
Okay, my name is Petrina Magano Celestino, and I'm a registered nurse. I'm a wife and a mother.
Okay, wonderful. Okay, before we go on with the bone and the flesh of our conversation, I'm just going to ask you a few personal questions, so to say. Okay, can you tell us about your hobbies and interests? What do you do for fun?
What do I do for fun?
Yes.
I think when you are a nurse, it's somehow what you do for fun. It's mostly when you're at home relaxing with your family. Yeah. But mostly what I love doing is reading. My spare time, I love reading. I love cooking, as well as just engaging with young people. Yeah.
Okay. That is interesting. Yes. So if you were to change careers, if you were to choose between being a nurse, what will the other option be?
Either a medical doctor or a psychologist.
Okay, I see you are a medicine person. You love the hospital, taking
Yes,
care
I
of
love
people.
it.
Okay, I see. That is really your passion.
Yeah.
So now, as a nurse and someone who works with patients on a day-to-day basis, what are some of the diseases that you have observed that people are suffering from that could be easily prevented? Some of those diseases that are preventable, but you see a lot of people like suffering from such ailments.
Okay. I think this question is I think it's based on different clinics, like the locations where you find yourself. For example, the way I work, it's in town. Most of the patients that we normally see, it's mostly STIs, sexually transmitted infections, and then there's a lot of high blood pressure, and also diarrhea. And what else? I think that's most of it. Like most of the patients, that's what they come complaining with.
Okay, that's in town.
Yeah, that's in
other
town.
places?
But in other places, let me say, for example, like there's a lot of there's diarrhea also, and then a lot of children are coming in with malnourished like disorders and all that. And then you also see that there's a lot of high blood pressure also uncontrolled, and alcohol abuse. Yeah, they come in and then they're at a point where they're unresponsive because they abuse alcohol or maybe hard drugs and all that. Yeah.
Okay, so you mentioned alcohol and drug abuse and STIs. Obviously, these are the things that one can prevent, but we find ourselves like people find themselves getting infected by these sicknesses or by these diseases. So what are some, apart from that, or maybe you can add to that, are there some other practices that we maybe do? Maybe I may not even be consuming alcohol, but there are some things that I do in my lifestyle that are actually detriment to my health that could make me susceptible to diseases and infections.
Okay. Just as the saying goes that too much of everything is not good. It also applies to less of everything or less of some things. It's
Yeah.
also not good. So what we need to do is we need to always observe moderation in the things that we do. Let me say, when you eat food, you make sure you don't eat excessively to the point whereby you are you are now obese, or the point whereby it's like you eat not because you're hungry but because you want to. It's like a thing of I just
Relieving
have to
your
eat.
stress.
Yeah,
Sometimes
you are
your stress.
stressed, you are binge eating, you are there's a lot of things that make people to do certain things, but in everything just apply moderation.
Okay.
And also, when it comes to food, we shouldn't just eat any kind of food. I know there's a thing whereby you feel like when you're enjoying yourself, you need to buy uh, unhealthy food, junky food, and
Ice
all that.
cream.
But yeah, ice cream, it's good, but in moderation.
Oh,
Just try
okay.
not to do excessively. Like once in a while, yes. Fatty food, fast food, all those things, they are really not healthy. So it's not something that you should be consuming on a daily basis, but once in a while, yeah.
Okay.
Yeah.
All
And
right.
also with alcohol really doesn't give you any, there's really no nutrients attached to it per se. So it's, in my own opinion, it's not worth it. Money wise, time wise, you can drink anything else apart from alcohol,
Yeah.
because now at the end of the day, you think you have drank something, you are hydrating, but then with alcohol it's actually not hydrating you. So you also need to make sure that you drink lots of fluids, not only water but juice and other drinks that are healthy as well.
Okay.
And then also, when it comes to drugs, we can also say it's smoking, and not only tobacco but also the hubbly bubbly. It's also not healthy. Like if you look at the reports, it's not healthy. Sometimes you can also promote someone to go and do hard drugs, because now it's like they are not getting enough of whatever is stimulating them to take it, so they want to take hard drugs. And then I also say, when it comes to medication, when someone, let me say, they are maybe they were diagnosed with high blood pressure, some of those things, it's things that we do unknowingly. You think you are trying to do what is best for you
Yeah.
by stopping the medication which you were prescribed. It's not good to stop medication without a healthcare provider telling you to do so. Yeah, because we see some of the patients that we see in the clinics, they come with stroke, but it's because they stopped their high blood pressure medication. So it's always good to get an opinion on what to do. If you want to stop something or you are not comfortable doing something, always seek professional help.
Okay.
Yeah.
Oh, I see. So talking about medication, okay, I also learned that it's not good. I don't know. You can correct me on this one. Is it right for maybe every time I get a headache, I take Panadol or those painkillers? Is it safe
Okay.
for every little pain you're taking?
No, it's actually not really safe to be taking medication every here and there, because remember, everything that you take in your body, it goes through the liver. The liver is the one that helps to break down the all those toxins, and then they're excreted through the kidney. So what you are doing, you're overloading those organs. What you need to do is, your body also has a way of helping you to cope with something. But now if you keep taking painkillers here and there, your body will become dependent on those medication for any other illness, unless if it's really really severe, then you have to take pain medication. But if it's not, you can do home remedies
Yeah.
that can help with whatever you are having. But otherwise, I wouldn't say it's good to be taking painkillers every now and then.
Oh, okay.
Yeah.
All right. Okay. So we are often encouraged to do full body checkup to just to see if just to check the health, our health status, because they say that if some diseases are detected earlier, it helps with the treatment of the disease. It can be managed rather than waiting and then until you're sick and all that, then people say, oh, okay, sometimes it becomes complicated to treat such diseases. So can you just explain to us what full body checkup is? What exactly are we checking, and how often should one do these body checkups?
Okay. At state, the most of the checkups that can be done, let me say for the woman, it's a breast examination, cervical cancer screening. Um, yeah, those are most of the ones that can be done, as well as HIV testing. They are all for free. Yeah, TB testing also. If one feels like they need a TB test, they can always come.
Okay.
With private, on the other hand, they can do a full body check, taking blood test and all that. At state, they can only do a blood test if you come in with a medical form from your workplace or from wherever you are getting it from. And if you come in with ailments or something like that, and then doctor feels like they need to do certain blood tests, that's the only time it can be done.
Okay.
Yeah.
So if one has like can go to a private doctor, they can actually just show up and do all these blood tests.
Yeah, the advantage of private doctors is that it's money that is talking on your behalf. As long as you have money, whatever test you need, it will be done. But with state, on the other hand, it's limited resources, and we have to cater for all the population.
Okay. So how often should one go for body checkup, and what are those specific ones that you feel like they are very important for one to check?
Okay.
Oh, you mentioned cervical cancer screening, and yeah,
For
breast
example, like
examination.
cervical cancer screening, because cervical cancer is one of the cancers that is leading. So we encourage the ladies from the ages of 20, okay, 20, from the ages of 20 upwards to be doing, it's normal. Once they do it, once you are done, you are given a follow-up ranging from 3 years to 5 years for follow. And for the HIV test, it's advisable for individuals who are sexually active at least once a year. Yes. Or unless if a need that maybe you are required to do it within 1 year.
Oh, okay.
Yeah. And then for men, they are advised to do prostate screening, which I know men are not keen to do, but try to come, especially when the elderly from the age of 60 years old. Please do come to the clinic and just ask, especially when you have symptoms that in line with the prostate cancer. Please do come through.
Okay. Do you mind telling us about the symptoms and
The
also
symptoms,
the danger of like delaying this test and all that?
okay,
Just so the people will see the gravity of.
Okay, like the symptoms of prostate CA is men will normally have, they'll be whenever they are urinating, it's like the flow is kind of like interrupted. Person is urinating in like small amounts, and it's like they feel like their bladder is not being emptied fully.
Okay.
And then they have like low abdominal pain. Sometimes it's also fever. All those things. It's always advised to go to the clinic. Just make sure you go for your checkup. You can always ask, can I please be done a prostate CA? I'm having this, or maybe my family has a history of prostate cancer or all that. It's very important because the earlier you do it, the earlier they'll detect it, and then the management will be less, how can I say, invasive.
Okay.
Yeah, because if they detect it early, then they are able to do whatever is necessary. It's not like you going for chemotherapy, for radiation when it's like a bit advanced. But it's always good to go earlier, and then they'll be able to intervene earlier as well.
Okay. Okay, the last question before we conclude or wrap up this conversation. So what are some of the basic things that we can just do, like basic things that anybody can practice just to maintain their health, to make sure that they are healthy, especially when you're on a budget, you don't really have a lot of money? What are some of the things that you can do to just maintain your health?
Reduce stress, drink a lot of water or fluids, other fluids that are healthy, eat healthy food that are readily available. We're not talking of papayas, all the strawberries.
Strawberries.
There's a lot of food that is readily available that is very healthy. So you make sure that you take that. And by the way, there's places where you can easily get fruits and vegetables like Stop and Shop. Some of those packs are not even expensive. So you make sure you get that, you eat.
From the street vendors.
Yeah, from the street vendors, as long as it's healthy, you make sure you clean it very well, then you eat. And then the other thing is also to make sure that you just take care of yourself. Make sure that if you have anything that you are worried about, always go and seek for help, especially when it comes to mental health. Depression, anxiety, it normally comes when people try to hold everything in and all that. So if you have any issue, any problem, always come out, seek for medical help. And then the other thing is also to always maintain good hygiene. Hygiene is very important. That is where most of the diseases come from. And also when you eat food, make sure that you cook it very well. Don't eat undercooked food. Try not to eat food that you don't know where it came from, especially the cooked one. And make sure that you always ask the ingredients that are put in the food, because some people are having allergies. Like around this time now, we are getting a lot of people who are coming in with allergy reactions and all that. So just make sure that you take care of yourself, live a very healthy life. Try to avoid alcohol, drugs, because they are actually not helping you in any way. And also just try to be active, live a very active life, run,
Exercise.
walk. Yeah, I think there's also a thing that is attached to when you see someone walking, you are like, oh, they don't have cab money or whatever, but walking is very, very healthy. So if you see wherever you are going, it's a short distance, walk. As long as you know it's safe, just walk. Yeah, try to do some exercises in the house. Yes, and make sure that you interact with other people. Don't just be at home alone and all that. Interact with other people. Go out, great, talk to the neighbors and all that.
Okay.
Yes.
Oh, thank you so much for those advice. I'm happy that you mentioned about mental health and all that. That is something really some people like focus on the physical. And we have a video actually on this channel where we spoke about mental health. So when you're talking about health, it's both mentally and physically.
Yes.
So in conclusion, is there anything that you feel like our audience needs to know when it comes to health?
Okay. We see a lot of patients that come to the clinic and they're asking you for antibiotics. So the use of antibiotics, I feel like it's something that is not really being addressed. The use of antibiotics is that you don't necessarily need antibiotics whenever you are sick. Because sometimes what you're having is a viral infection, not that you need antibiotics. So antibiotics, only use it when it's necessary, and make sure you finish the course. Because if you don't finish the course, then you become prone to this certain infection. Because now what happens is that that virus or bacteria, it becomes resistant to the antibiotic because you did not finish the course. So always finish the course, and then you make sure that you only take antibiotics when it is necessary. Yes.
Okay. So some people have the guts of walking up to a pharmacy and ask for antibiotics.
Yes.
Okay, that's very interesting. So thank you very much for your time. We do appreciate you coming here. I believe that our viewers have learned a lot as much as I have. So thank you so much for staying up until this time. Once again, please don't forget to like, share, subscribe, and I remain your sister Rosa until I come again next time on your side. Bye.